Why is white matter integrity important for schizophrenia diagnosis? Imagine your brain as a busy city with roads connecting different neighborhoods. White matter is like the highways that allow messages to travel quickly and smoothly across the city. When these highways are damaged or not working properly, traffic slows down, and the city's functions get disrupted. That's similar to what happens in schizophrenia. White matter in the brain is made up of nerve fibers covered with myelin, a fatty substance that insulates these fibers. This insulation helps messages travel faster and more accurately between different parts of the brain. White matter integrity refers to how healthy and well-organized these connections are. If the white matter is damaged or less organized, communication between brain regions becomes less efficient. In people with schizophrenia, research shows that white matter often doesn't function normally. Using special neuroimaging techniques like diffusion tensor imaging, scientists can see how water moves along these nerve fibers. When the white matter is healthy, water moves in a very organized way, which is measured as high fractional anisotropy. But in schizophrenia, this measure is often lower, indicating that the white matter is less organized or damaged. This is especially true in areas like the corpus callosum, which connects the two halves of the brain, and other regions like the internal capsule, cingulate, and cerebellum. These changes can be seen even before symptoms fully develop, sometimes in the early stages of the illness. Why does this matter for diagnosis? Well, these white matter changes are linked to how severe certain symptoms are. For example, when the white matter in specific regions is less healthy, people might experience more intense hallucinations or delusions. Also, damage to the white matter can be connected to poorer insight into their illness, which can make treatment harder. White matter issues also help explain some of the cognitive problems seen in schizophrenia. Many patients struggle with memory, attention, and decision-making. These cognitive issues are thought to be related to disrupted communication between different brain areas caused by white matter damage. Another reason white matter integrity is important is because it might help identify who is at risk of developing schizophrenia. For example, young people at high risk who do not show normal white matter development over time are more likely to develop the disorder. Detecting these early changes could help doctors monitor and intervene sooner. While traditional diagnosis relies on symptoms and behavior, adding neuroimaging that looks at white matter gives a biological picture of the brain. Although neuroimaging isn't routine in clinics yet, ongoing research aims to make these tools more practical for everyday use. In short, white matter integrity is key because it reflects the underlying brain changes that contribute to symptoms, cognitive issues, and how the illness progresses. As imaging techniques improve, measuring white matter could become a standard part of diagnosing and understanding schizophrenia better.